Meet Jason. He's a hardworking plumber who puts in 60 hours a week on the job. For the past 3 months, his life has taken a painful turn. He's been dealing with terrible stomach aches that come and go, along with constant nausea and episodes of throwing up. Jason was in the emergency room several times, hoping to find out what was wrong. What Jason didn't know was that the real cause of all of his suffering was a product he was using to cope with stress at work. The very thing he thought was helping him was actually making him sick. Join me in solving this pain mystery today. Doctors in internal medicine checked him over, specialists in stomach issues examined him, and even surgeons got involved. He went through tests after test, but everything came back normal. No one could figure out what was causing his problems. Jason is under a lot of stress at work. He has put in long hours just to make the same money. At 42 years old, he's a father of 3 kids and a stepfather to 2 more from his wife. He loves being a plumber, but juggling work, family, kids, and finances has become too much for him. After a 10-hour workday, all he wants is to relax, but for the past 3 months, even that has been impossible. He can't eat without feeling sick, and the nausea soon turns into vomiting. Jason is fed up with the endless trips to the emergency room. He's been through countless blood tests, abdominal x-rays, chest x-rays, 2 endoscopies, and even a colonoscopy. Despite all of this, the doctors still can't figure out what's wrong. They've tried giving him different medicines to ease his symptoms: esomeprazole, metoclopramide, ondansetron, chlordiazepoxide, and clidinium bromide. This helped for a little while, but the relief never lasts. Jason feels stuck with no answers, no end in sight. The doctors at the hospital knew Jason well. He was a regular visitor to the emergency department. One day, a doctor suggested him to see a psychiatrist to explore whether his symptoms might be linked to something psychosomatic. Jason didn't think his vomiting was connected to emotions, but he agreed to the idea and made the appointment. During his session with the psychiatrist, the exam didn't show much beyond mild anxiety and Jason's preference for treating health issues with natural remedies. When asked about substance use, Jason revealed that he regularly smoked cannabis, about 3 grams, 12 times a day. He'd been using it for over 5 years and had increased his use recently to deal with stress at work. The psychiatrist then asked if Jason's vomiting got better after taking a hot shower. Jason instantly said yes and seemed surprised. None of the other doctors had asked him this before, and he had thought that the connection was too silly to mention. Jason admitted that long, hot showers were the only thing that completely relieved his nausea and vomiting. However, this was causing tension at home because he kept using up all the hot water. The psychiatrist explained that Jason had a classic case of cannabinoid hyperemesis syndrome, CHS. This condition is well documented in medical research and causes repeated nausea, vomiting, and stomach pain. Interestingly, hot showers or baths help over 90% of people with CHS. The psychiatrist educated Jason about the risks of long-term cannabis use, suggested non-drug ways to manage his stress. Jason cut back on cannabis, and within days, his symptoms disappeared completely. Over the next year, he didn't experience any more episodes of nausea, vomiting, or abdominal pain. This case highlights some important lessons. People should be aware of potential side effects or complications related to the products they use, even natural or over-the-counter ones. Anxiety and stress can often be managed effectively without relying on medications or substances. Doctors should always ask about lifestyle habits and substance use when treating patients with unexplained symptoms like nausea and vomiting. Psychiatrists play a vital role in addressing health issues that involve both the mind and body, but especially when complex factors are at play. A referral to a psychiatrist doesn't mean the symptoms are purely emotional. Instead, it reflects the values of a holistic approach to understanding and treating health problems. If you like this video, consider subscribing to this channel. And if you're interested in learning more about brain retraining techniques, check my courses on YouTube. And please remember that this video is not intended to provide medical advice. If you have a painful condition that needs proper diagnosis, consult your doctor. And if there is an emergency, call an ambulance or go to the nearest emergency department. This video is for educational purposes only. Thank you for watching. Goodbye.